That good music, healthy music. You know, it's time for Ultimate Health with me, Nortey by Nature. Thanks for tuning in wherever you are. We do it for the cause and not the applause. Once again, I have Dr. Divine Benyubala, Registrar of the Medical and Dental Council, in the seat. We're still reflecting on 50 years of medical regulation in our dear country, Ghana. They've just had a landmark conference here in Accra, an international conference looking at medical training and practice in Ghana. Key points, we'll go over that. Last 2 weeks we had him, we talked about the processes and the steps to lodge a complaint with the Medical and Dental Council. He told us of the composition of their panels, their penal codes. Wow, and he's back here again with us. Doc, you're welcome.
Thank you very much.
Charlie, I thought I'd lost you, but I know you've been so busy, so busy.
It has been a very busy week.
Yeah.
And we thank God for a successful event.
Exactly.
And we also to thank your Joy FM for being a worthy partner.
We don't have a choice.
It was such a fantastic show, and your own Kojo was there to MC the official opening.
Great stuff.
And His Excellency did us the honor. The Vice President came. He was ably supported by our Minister of Health. The Minister for Science, Environment, Science, Technology and Innovation was also there. Mm-hmm. The Volta Regional Minister, who is himself also a healthcare practitioner, a doctor, was there. Right. And then, of course, our Minister was supported by his deputy. And then, unfortunately, the Minister of Education couldn't come in person, but he was ably represented by the GTEC, Deputy Director.
Stuff. Great gathering, monumental landmark discussions and conclusions. We'll come to that in a sec. But one of the key things I picked up, we picked up a lot of lamentations about the disparities in distribution of medical personnel. And I saw somewhere that you had underscored that in about 8 of our 16 regions, we don't have senior specialists at all. And then I also read that of the, I've forgotten how many practitioners we have, but 83% of our registered practitioners are in Accra and Kumasi. That is not great.
That is so. And it's part of the reason why this historic conference was opportune. Yeah. We indicated clearly that from the data that we have, that for our senior specialists or the fellows, as we call them, those capable of training the next generation of doctors and dentists, 83% of them, 64% precisely, are in Greater Accra region. Wow. And then Ashanti region has an additional 19%. You put that together, it's already 83%. Right. And we think it is unconscionable as a state for us to, as a statutory regulator, to watch this happen. Okay. But the good thing is that one of the key areas of consensus that came is the decentralization of both undergraduate and postgraduate training. Okay. And so it is now the responsibility of the Medical and Dental Council and the College of Physicians and Surgeons to work together with the critical stakeholders to ensure that this consensus area is pushed. We're going to put all of this together and forward it to the policymakers for their support and blessing. All right. So precisely, the reasons why this conference was important was to redress these areas of inequity, not just in distribution of the numbers, but also quality of care. Right. Because to have quality health, medical and dental services, you need the most qualified doctors to be present in the regions and the districts. Okay. And unfortunately, as you say, 83% of these persons, as reflected on our register, specialist register, in the Greater Accra region, and we think, and then Ashanti regions. All right. And we think this is not satisfactory. Okay, great. For 13 minutes past the hour of 2 on Joy 99.7 FM, you're with me, Nortey by Nature. I am with, on your behalf, Dr. Divine Benyubala. He's the Registrar of the Medical and Dental Council. For the past couple of weeks, I have locked him down here because these issues are important for all of us. Okay, what is the quality of medical and dental training?
Who is regulating practice? What happens when something goes amiss, something goes wrong, and so on and so forth? We've just been talking about the disparity in the numbers, and they've taken on the charge, really, the duty, the obligation to make sure that we can balance the numbers and also, should I say, maintain and enhance quality of care across the country. Shouldn't matter.
That is so.
It shouldn't matter where you are in the country. You should have. In fact, I believe our constitution guarantees you access to quality health care. But Doc, just quickly on that one, is it not a reflection of where we have the facilities? I mean, most of our good facilities are in Accra and maybe Kumasi, or am I wrong in thinking that? Hasn't the distribution followed where we've provided the infrastructure and some of the things we need?
Partly correct, but medicine, it is not just the facility,
okay,
but the quality of the personnel there.
Right.
So what a consultant, a fellow can do in under limited resource environment is much better than a lower level professional. And that is the more reason why we should. The second thing is that our governments over the years are actually doing well in terms of expanding access to appropriately equipped hospitals across the regions, the districts, and in some cases, the community level. And we think that we are not actually utilizing the facilities well.
All right.
For example, you put a $20 million district hospital, which can then have facilities for CT scan, MRI, and other things.
Right.
But if you don't have the appropriately trained doctors to provide that level of service, you end up having only medical officers.
Right.
In that district hospital, and that will not be, generating and driving the efficiency that we require.
Okay.
Because we think that at that level, we should be able to leverage on that to train not just only doctors and dentists, but other cadres of the healthcare professional team.
Okay.
And so we think, in fact, it is the reason why we think we are better placed. And remember, the current government is pushing Agenda 111.
Right.
And we are absolutely excited about that. That is because we can then ensure that now that we have firm consensus that this is what we want to do, then those hospitals will have to be relooked, their design.
Okay.
And then modifications done to accommodate training and higher level of service delivery at those levels.
Okay.
And
but Doc,
that is the shortest cut.
Right. Let me just quickly ask. Right. Let me just quickly ask you that. You say you want to have an input to the redesign of these facilities so that we can integrate enhanced training capacity.
Yes, that is so.
Okay, so is that to say that currently that input hasn't been made or available, or that path hasn't been made available to the relevant stakeholders like MDC and co?
Yeah, so not so.
Okay.
What it is that at that point there was no consensus that we should ensure that we decentralize our both undergraduate and postgraduate training. Now we have that consensus.
We've agreed on that.
We have agreed on that.
As an output, a yield of this conference. There's an agreement to do specifically what?
Decentralize both undergraduate and postgraduate training of doctors and dentists in this country.
Okay.
As a key driver of, one, the numbers, two, the skills mix.
Okay.
Redressing issues of inequity in distribution, not just general practitioners, but also in specialists.
Okay.
So because remember that our healthcare sector policy deals with basic quality healthcare and timely healthcare services across the region.
Okay.
And you mentioned it. It is a constitutional obligation that we have to work. And if you look at the under directives, principles of state policy, to work incrementally, to expand not just access in facilities, but also access in the quality of the services that they receive.
All right, great stuff. 18 minutes past the hour of 2 on Joy 99.7 FM. It's good to hear these things, but it's even better when we can see them manifest, right? There's a lot of talk in our part of the world. So it's good that there's been such a pivotal conference and it's coming out with these decisive, should I say, agreements and responsibilities, obligations. If you've just joined us, it's 19 minutes now past the hour of 2 on Joy 99.7 FM. I'm with the Registrar of the Medical and Dental Council. We're looking at some of the outcomes of this landmark conference they just held between the 29th and 31st of August here in Accra. big decisions, big stakeholders and partners. I heard a couple of the comments made by the vice president. He talked about clinical malpractice. He talked about bridging the gap and not just talking about quality of those who come from outside with training and many other things. And we need to look at that. I read that doctor to patient ratio currently is 1 to 3,000. And I think the world standard or the WHO standard should be 1 to 1,000. So we are way off the mark. And it's not just about increasing numbers without thinking about or without considering quality, right? Yes. So that's what they've been tackling. What else came out of this important conference?
Importantly, issues around the quality of training in terms of, and also quality of conduct.
Okay.
Came up, and fitness to practice that we started the last time we touched on it.
Good.
All of this came up. But just to make the point that the vice president actually reflected the Office of President's concerns about how Ghanaians feel, the treatment they get. We got one of the professors who has done extensive work on what the Ghanaian public expect of doctors and dentists.
Right.
And that was shared with us. It became obvious that we needed, and a major consensus areas that we needed to then readjust, restructure, and reform the curriculum of training and input these soft skills. And interestingly, in fact, it was general consensus that our doctors and dentists must learn how to speak French. So input French, input ethics and entrepreneurial skills for the obvious reasons. Apart from the sea, the rest is surrounded. We are surrounded as a country by Francophone.
Okay.
We belong to the West African Health Organization, WAHU community. And you will find that the key languages there are English and French, and the Francophone outnumber us.
Okay.
And it is important that if we are setting up as a country to be the health tourism hub of the West African sub-region, then the frontline doctors who will be consulting, it will be useful in the near future for them to have some level of competencies in French and other languages.
Right.
But to touch on it, one of the key things is that we are worried about the quality as reflected by His Excellency the Vice President. So the conference key takeaway consensus point was we should focus on training the appropriate cadre. If you tax shift, you can't expect the same level of professionalism and competence.
Okay.
So if there are doctors that are not enough, let us put in innovative, pragmatic.
To get more of those.
To get more of those.
Right.
Because otherwise it also undermines treating Ghanaians equally. Because it will mean that if you are in the district hospital, then a certain middle level cadre is okay for you. But when you are in the region or in the national capital, then that is when you deserve. And I don't think the Constitution is quite clear on that. That every Ghanaian everywhere should be able to access basic quality. The other thing had to do with financing of medical and dental training and practice. And it became clear that currently the medical and dental schools are not charging realistic fees. So because of that, they are not able to also expand.
Right.
And there's been decades of investment in expanding local training. With our knowledge of the volumes that go out to train, and then the feedback of the quality that we have, which was made manifest in the conference, it became obvious that we should be investing in local production, which meant that the investment should go to leverage on both the public and the private training institutions, and we should support them as a country. And there are a lot of spin-off benefits that we may not be able to go into. Are we putting
that much currently? I know these are spin-offs, but I just want my listeners to get a sense of how important some of these consensus areas are. If you say that the medical training generally is under-resourced, even though we may be increasing comparatively over the years, under-resourced, and we have parents who are paying not just an arm and a leg, their lifetime to put their children through medical training, knowing that it's a worthy vocation, right? How exactly are we expecting this to happen? Is it just an increase in government vote into these areas? Is it more partnership with the off-takers of the products? How are we going to do that?
We are looking at a multiplicity of considerations and factors. And one is to, speak with central government to invest more.
Okay.
The other is to leverage on PPP arrangement, private-public partnerships.
Okay.
Because we have seen that in our context, we now have 2 private medical schools that are churning out very good graduates for us, like our public institutions.
Okay.
And we think that government leveraging and then, improving their ease of doing business and providing support, including exemptions and tax incentives, might. But also to get private providers to come in to invest. And we are also looking at development partners generally to support that initiative. But importantly, a key consensus area was that the medical training started as an independent university college.
Yeah.
Then for the award of degrees, it started as Ghana Medical School.
Right.
Then became University of Ghana Medical School.
Exactly.
We have found that over the decades, there has been incremental loss of autonomy.
Right.
Such that the general university system does not recognize that training a doctor is a different ballgame.
Okay.
And it costs more.
Right.
And therefore, it is actually one of the fetters against the rapid expansion in terms of logistics infrastructure to be able to train.
Yeah, let me just break that down. So when the medical schools had autonomy,
yes,
right, in many words or in simple words, they could determine their direction, their capacity, their thrust, their focus.
Yes.
Things were more efficient.
Excellent.
And the thinking of this conference is that we should be headed back in that direction.
Yes. So we have to, it is non-negotiable. The medical schools have to get their autonomy back to be able to direct investments appropriately so that we can leverage, in medicine, science, and technology, things change so quickly.
All right.
And they need to leverage technology to be able to improve teaching methods and teaching aids. They need to leverage, in fact, the kind of faculty they recruit.
Okay.
So for the clinical level, our ratios are 1:8.
Wow.
But the general university is not looking at that.
Mm-hmm.
So you have maybe the whole of the medical school being given, approval to recruit 10 lecturers in a year.
Right.
Distribute it over, pediatrics, general surgery, orthopedics.
So you're saying that if the universities could determine, if the medical schools could determine that for themselves, go head hunt, pack up their faculty, and then give out higher quality, enhanced training.
Excellent.
All right.
Then also, we have said that we are going back to applied scientists.
Science, okay.
So the doctors should be the ones to teach the basic and paraclinical sciences so that it is applied medicine.
Okay.
So that we don't have raw physics, raw biochemistry being churned out.
Okay.
And then when they are getting into the clinical year, making the connection becomes difficult.
All right.
So, and that has also been a point of consensus.
So this is actually a reflection and, should I say, a fine-tuning of curriculum
and also the appropriate human resource.
Right.
That will be there.
Okay.
Then also, we say that for them to be able to do that, the college is looking at ensuring that members have MSc or MPhil in that particular discipline.
Okay.
So that they are able to be taken as lecturers, and then fellows will have a PhD in the related discipline.
Right.
Then also leveraging on the diasporan resources, including expertise.
So what you're saying is our Ghanaians who are doing, in quotes, galamsey outside and enhancing themselves, who very often are keen to support and augment faculty here.
That is it, and that is
we
why
want to harness that properly and formally.
That is why galamsey is not an exact descriptor.
I know.
Because they are a valuable resource.
I know. Yeah.
A lot of experience there. These persons are in big institutions,
right?
And we could leverage and twin these institutions to our local institutions, so that we will share, in their experience, in their knowledge, in their expertise, but also in terms of equipment and logistics.
Right.
And more importantly, research,
Mm-hmm.
collaboration.
Right.
And those are key areas.
Key
But
areas.
more importantly, we have a lot of experienced faculty.
Mm-hmm.
I'll tell you that we had very senior members of the profession,
Right.
93 plus,
Okay.
who sat from morning to evening.
You're not talking about the number of them. You're talking about their ages.
I'm just giving
Oh,
you the age.
Right. Okay.
93-year-old
Sitting in your conference.
sitting in the conference,
and
it
able
tells
to-
you the commitment,
Okay.
the passion with which the profession came together
Mm-hmm.
to provide this direction for our country, because they know the value that the consensus we are talking about will bring to this country
Okay.
in the near future.
Okay. Great stuff. Almost 30 minutes past the hour of 2 on Joy 99.7 FM. This is a revealing discussion I'm having, a post-conference discussion. As part of its 50th anniversary, the Medical and Dental Council is putting itself, should I say, under the knife, under the scalpel, right? They are cutting themselves open and examining their own anatomy, their own processes, their own structures, and looking to leverage that to enhance the regulation and, of course, the delivery of medical and dental practice in our country, Ghana. If you have any questions, concerns you want to share about our discussions here in the studio, WhatsApp is 055 11 11 997. And very shortly, I will activate the phone line so you can join. In fact, let me just announce the phone line, 0302 216 541. You can call us and tell the registrar he's been looking for and he's been eliciting and actually tapping reflections on 50 years of medical and dental regulation. Are we on the right track? What do you think? And one of the things and one of the reasons why he's been with us all these weeks in Joy FM is that he wants to hear from you as well. So this is not just for professors and specialists and surgeons and policy makers. This is for you as well. So feel free to join us. The phone lines are active. We're live on Facebook and YouTube. Now, Doc, interesting, should I say, core areas of consensus. I've heard you mention finance or resourcing, faculty, resources, and even admission processes and many other things, and decentralizing.
Yes.
So we want to have a very, very well-structured and universal process under your watch.
Yes.
Okay. So it's been like, well, for 50 years, is it that you've been, should I say, conducting an orchestra that is playing in the symphony, or, and we want to harmonize what everybody is doing for the better collective good?
The value of scientific inquiry is the commitment never to be satisfied with the status quo.
Okay.
And to continue to probe and to continue to challenge yourself.
Right.
And it is then that what you thought was impossible becomes possible.
Okay.
Otherwise, we wouldn't be attempting to be on the Mars today.
Right.
And that is the approach we take, especially as the leaders of the healthcare team. We have a responsibility to say that, look, practice of medicine is changing rapidly. Science, innovation, improving rapidly. What can we do to get the best? I'll tell you, one of the most humbling feedbacks we got from what the Ghanaian public expect of the doctor is that first, they expect a technically competent doctor.
Okay.
Second, but also a doctor who smiles.
Right. So we're
who listens to his patients.
Soft skills.
Bedside
manner and all those.
Empathize.
Right.
Those things. And you see, unless you stop to listen, you will then be driven by just technical competence and continuing to do that, and you miss it.
Doc, let me just ask you before you hold that thought there, but how did you get that? You said you had this humbling contribution or revelation, disclosure. Is it that a member of the public got the chance to speak? How do we capture this?
So we provided, and that is how historic and unique this program was.
Okay.
So there was a whole period where we provided a learned professor from UCC who come from their counseling unit, a former director of that unit actually. And she has done extensive work on Ghanaian patients' expectation of their doctors.
Right.
And when she started off, there were the good,
the bad,
The bad and the ugly.
And the ugly.
Downright ugly.
And this was not, prevented. This was allowed to flow.
Oh, yes.
Right.
In fact, that's what actually we needed that.
Okay, so Doc, just quickly hit on it again. They want a doctor who is technically competent.
Yes, first, technically competent.
And then?
But a doctor who is human.
Human.
Smiles.
Mm-hmm.
Empathizes with them, will listen to them,
okay,
and will touch them in an appropriate manner. Not a doctor that before they can finish talking, the prescription is in hand. And things like
they
that.
Don't want a quack doctor.
No quack.
They want
in
empathy.
The medicine business,
right,
you are dealing with, at the center of it is the human person.
Okay.
And
I'm loving this.
Any activity that undermines or tends to devalue.
Treat people with dignity.
Respect. And respect. That is it.
And this is the feedback you're getting from somebody
the feedback we got.
who has studied.
Oh, and I wish you were there. In fact, you can actually go onto the website
online,
and still listen to some of it.
Okay.
And if you heard the kind of things that they said,
all right,
it was humbling. And I'll tell you, for example, a patient comes and then puts the hand on the table of the doctor.
Right.
And then you get a very unwelcoming response from the doctor.
The doctor is angry.
Take your hands off.
Take your hand off my desk.
Do you want to give me Ebola or some strange thing like? And
And these were captured as what? Anecdotes or things that people have sent.
Detailed.
Wow.
Research.
But Doc, let me ask you: does it mean that over the years we've been training doctors or indirectly, unconsciously, getting them to download this attitude that is being reported, that is being disclosed? How do they get that attitude where they don't smile or where they are disrespectful of their clients, their patients? Where do they get that from? Is it not the training?
That is the key
because
thing.
There are doctors who were trained and they're so frightened. In fact, frightened is not, scared of their consultants, right? Is it that we were putting something in them and now we seek to correct it?
The temptation is that because you are a well-trained doctor, a technically competent doctor, then you must know how to behave well.
Right.
It became obvious that we need to emphasize and remember that we are in generation Google.
Right.
And our curriculum, our methods of assessment, methods of curriculum delivery need to be guided by the current status of the current generation. And one of the key emphasis is ethics. And ethics is not something that you think you will grow and just know.
Yeah.
Because it's a technical discipline, and unless it is part of the formative assessment.
Right.
And one of the key consensus points is that somewhere in the middle, we run away, leaving an important component of this profession, which is mentorship, coaching, and supervision.
Wow.
Because of the vicissitudes of everyday needs and work. And it became clear, and it's one of the consensus points. That's why it's important to retain very experienced faculty. They may be 60, they may be retired. They are not tired and they are not retarded. That is when you hone the skills and they can then mentor, coach, and supervise the young senior specialists and consultants to mold them in the professional way. Because if my teacher is present and my student is also present, can I be sitting in the house leaving only the senior resident? No. So getting back to ensuring that we have the appropriate, not just technical competence, but conduct and ethical values. All of these are the basket of approaches that we are adopting. And happily for me, it was unanimous.
All right. Great stuff. 38 minutes past the hour of 2. My phone line is active 030-221-6541. Call us. I want to hear your voice on this before I go. Ghana is not for Nortey or Divine, right? This is an important discussion. Hope the conference was not just talk, and merrymaking, but the citizens will see whatever was discussed comes to fruition sooner than expected. Many meetings, conferences, events, what have you, and nothing to show for it. This is from Dede in Maryland. She has a point there.
Oh, right? She has a fantastic point, and I can assure her that actually at the end of the conference was the consensus for agenda for action. So we are just meeting to fine-tune the conference report and then tease out all the action points.
So we can hold
this
your
is something that we have already started. For example, we have already engaged the college. The college has already signed an MOU with the Ghana Health Service, and tentatively, all the regional hospitals that are coming up or are currently in existence are potentially training center institutions.
Okay. Great stuff. 39 minutes past. Yeah, I need to hear you speak on this. Good afternoon, bro. But why don't politicians attend hospitals in the country and fly to other countries? Seth is asking this. Yeah, that makes sense. Eh?
It is.
What are they running from?
In fact, it
even
was
your
one of
own
the
professors are going outside for.
So that's it. Because if there's underinvestment, you may have the most knowledgeable doctor, but if the equipment is not there, the logistics are not there. Then they cannot do much with their empty hands. And unfortunately for us, this is one of the reasons actually. Because we are having one of the consensus points is that UGMC, for example, which is an academic medical center, the general consensus is that it should be revert to its original role as a center of excellence for specialty and sub-specialty training. So where we can do high-level things and there will be no need for any member of the Ghanaian public to fly outside.
Okay, great stuff. Though I'm not a health professional, I have been in the health space since or close to 20 years. I think the kind of problems Dr. Divine and team want to bring into the medical training curriculum is a top-notch approach. The government and all stakeholders must embrace this in a hurry. The people's skills is very important as much as the technical skills needed. This is Caleb Etonam. Sure, ethics can't be replaced with knowledge. All right, I have a caller on the line. Hello, good afternoon.
Good afternoon. I'm Christian.
Christian, yeah. Share with us.
Yes. Dr. Divine, thank you for this time. I think whatever you are planning to do, if well implemented, it will help Ghanaians and it will help the medical profession. I remember very well, I won't mention the name, I attended a facility in Tema. The doctor just wrote medicine for me to go and take other place. I said, no, I want to know what's wrong with me. He told me but he's giving me medication. That's I said, well, no, I want to know what's wrong with me. He didn't agree. He just gave me a prescription. Indeed, I didn't accept the medication. I went out, spoke to the nurse. I need a physician, a senior physician to attend me. He said, why? And I explained it. He said, well, looking at the medication, he's giving you a good medication. I said, no, I need another for a second. Fortunately, they agreed. And I was sent to another physician, and he had some students around him. So upon saying my pain, he just paused and told them to listen to me and asked me to repeat it. Indeed, when he sent me to the lab, after my medical lab, I was given no medication because it was as a result of withdrawal symptoms from a previous medication that I had been on for a long time when I was taking off it. So they knew, and he was a younger doctor anyway. Young doctors need to be well trained, as you are saying, and it's a good one. The ethics, the human factor is very key.
Exactly.
Because sometimes just talking to the person alone or the patient could get relief. So I'm happy you have done this diagnosis, and we pray that you implement it to the latter.
Thank you.
So that we can get a benefit. Thank you very much.
Thank you so much for the feedback. And this is actually why we valued that after 50 years of reflections, we needed to pause and listen to our critical
More
stakeholders.
reflections flowing in. Let's take another caller. Hello.
Hello.
Hi. Who am I speaking to?
Yeah, you are saying to Abna from Bawe.
Abna from Bawe. You're most welcome. Share with us. Give us your diagnosis and your reflections.
Actually, I've been listening, but all I wanted to do is I sort of inherited some pediatric books, and I wanted if the registrar will be interested in putting it in their library.
Okay, right. Let me address that. Some years ago, there were a couple of Ghanaian doctors outside, and they get journals on a regular basis, right? And they wanted to package and send it down to Ghana to give us current updated, because they just get them through the mail and stuff like that. And they had engaged our foreign ministry, and to their shock and horror, they were expected to pay some of the freight, and this became a whole thing, and they stopped this. Now, this woman, Abna Ngbawe, is saying, I've inherited textbooks, pediatric textbooks. I don't know how current they are, but when somebody wants to help and augment our library, our reading materials and stuff, how can they do that?
They can do that by simply contacting the official agency in respect of this. So, for example, if it is medical training materials,
right,
you come to a medical school,
right,
you
University
meet
of
the
Ghana
dean,
Medical
exactly,
School. Right.
And then they can then have conversations with you once they understand what the support, the nature of it, and then the character of the items that are or equipment that are in issue.
Okay.
Then they can forward it through their ministry, and then the minister would then forward it to the Ministry of Finance.
Okay.
And all of this will be sorted out. Often people ship in the thing, and once they reach here, then they now try to say that they were meant to be gifted.
Okay.
And then it generates the delays,
All
and
right.
then you accrue demurrage and
Okay.
things like that. So those were the matters we used to have even at the level of Ghana Health Service and the Ministry
Okay.
of Health.
All right.
But I think that over the
Direct
years,
to the appropriate
this
institution,
engagement, yes,
and they should have a stake.
that will lessen the
Right.
burden.
Okay,
Yes,
great.
please.
Another caller. Hello, good afternoon.
Afternoon, Mr. Mercy. I hope you're doing well.
I'm great. Ajiman Joseph, eh? Yes, there's a bit of noise in your background, so if you can, yeah. Are you on an Okada or something?
When you talk about the ethics, in case a patient is being watched and the person hasn't got what it takes to pay, even though they can't use the health insurance, the issue of let's at least give the patient, let's say, some care before the person pays is also part of the ethics.
Right. Okay. So coming back to ethics and ethical practice. So somebody is before you. They have a clinical issue or maybe even an emergency, and you refuse to treat them or attend to them because they cannot prove that they can pay or they don't have the money, and they attend away sometimes in taxis or go to another facility. He's asking, doesn't that become a matter of ethics?
Yeah, that would be
what is the doctor supposed to
seriously
do?
ethically problematic.
Right.
And I must state clearly that there is a professional responsibility to treat in all emergencies.
Right, with or without hang on.
Yeah.
With or without bringing in health insurance.
No,
you must
Because
administer treatment.
You must administer treatment.
Right. Are you aware at the council that facilities, let me start by that, and indeed maybe often registered practitioners do turn away people, and the reason being they can't pay or this or that. And we're saying that is not tenable.
No, that is not tenable. And also it will not be maybe in respect of an emergency situation. And we have the National Health Insurance Scheme to deal with issues of financial access.
Okay.
So 3 access: geographical access, financial access, and then basic quality healthcare access.
Okay.
So our conversations have centered on geographic and quality.
All right.
Because the quality component has been lagging behind.
Okay.
But I think that these are matters that must be taken with the National Health Insurance Authority, so that the issues will be resolved. But it's professionally untenable, to say you are sending somebody away with an emergency situation.
Sometimes without even looking at them.
Without looking at them, that will not be acceptable. And
what should a person do in that respect? You can't force the doctor or the hospital to look after the patient. So in your distress, you go looking for another facility and hoping that you get a better response.
That is so. But the person can complain about the conduct if that person is a medical doctor, a dental surgeon, or a physician assistant.
Right. Okay.
That person can make a report to us in addition to reporting to the head of facility.
Okay.
Often we have a number of cadre in the healthcare space. And unfortunately for us, you may even be a security person who tells you there's no space.
That's why now you're giving them unique identification
numbers. That is why it's important to identify
who
is making the decision.
Okay. Right. Great stuff. So now, if you've been following us over the past couple of weeks, doctors have unique identification numbers and unique tags, and actually a specification of the kind of attire they are supposed to wear. We've talked about that in the weeks past, but again, Doc is emphasizing assertively that under no circumstances should a practitioner send you away or refuse to give medical attention. It's going to be an area we'll have to pick up later. I'm surprised that all of the problems we have in Ghana, you are thinking about speaking French. I'm also surprised that you only refer to one person's publication as a reference of what the Ghanaian expects. 50 years of reflection should be deeper than this. There was a very broad conference.
Okay,
but I'm sure Doc will speak to this.
Yeah.
Let me just read out a couple. Nortey, what is the retirement age? No, good afternoon, Nortey. All your guest is talking about is expectations on the doctor. What are the expectations the doctors, especially addressing the causes of doctor attrition and flight? Togbui in Taifa or Tafa. Nortey, what is the retirement age for public sector doctors? I ask in terms of deployment of experience and expertise. All right.
Yeah. So the first one is
about the French?
It's important for our Ghanaians in general. And if I had the capacity, I would make French a second language for the Ghanaian, just by virtue of the geopolitical area in which we are. So it is not undervaluing that. Okay. It will be unfortunate. Maybe the person does not have a broader perspective where we are sitting from. Okay. Second, as a regulator over the years, we have received from our regulatory actions, we have information.
Right.
But as a critical and accountable professional regulator, you will expect stakeholders to give you feedback to see whether it will affirm what you already have.
Right.
So you find that through other conference, there was nobody from the Medical and Dental Council speaking because it was a period of reflection. And so we have received multiple sources, but this is an academic forum.
Yeah.
And somebody who has done extensive work.
You refer to a specific paper.
Yes.
Nowhere did you say that alone.
That's the only thing, because we have multiple sources. But it's an academic forum. And a lot of these concerns have been properly reflected in where research, where biases and other things have been minimized. And therefore, when you are having that engagement, it's much more realistic.
Right.
And so we will say that we will need further conversation with my friend there. If I have their details, I could have invite them to the office, and then they can understand the broader things, because we need every Ghanaian to know what we do.
Right.
The second part is that we talked, in fact, retention of this critical skills mix was also an issue. And if you check, the consensus area is to make sure that we implemented the rural incentive packages.
Right.
And there was a suggestion that we should go back to where we have module schools in all the regions, so that not just only doctors, but all public health sector.
Post you,
but when the
family will find a school
that is good enough,
that,
to be able to have that.
Okay.
The retirement age generally is 60, and in a few instances, people can extend up to 65 on a 2-2-1 basis, as set out in the Constitution.
Okay.
It was one of the key considerations. For us as professionals, a professional does not retire.
Okay.
It doesn't. So the mere fact that you are 60, actually maybe when your experience, and we need you to coach and mentor the next generation and bring in bigger research.
Your role may change,
yes,
but we are harnessing
but we are harnessing those skills and experiences and expertise to drive the process forward.
Right, great stuff. 52 minutes past the hour of 2. I've got about 8 minutes to ground zero time, but we're doing great stuff. And for the listener who said, is that the only source of information about what the Ghanaian wants? If you know what you want, express it. We've got a platform here. We're using it, right? They are doing a reflection, and indeed what he shared was, to me, a very critical and toxic introspection, right? But he shared it. If there's more, share it here and let it come on board. That is what I say to that comment. Dede in Maryland is asking, did the first caller report that the doctor who refused to provide information but insisted he should accept the medications to the head of the facility or the hospital, that doctor must and should be seriously reprimanded? This is from Dede. And again, these are the kinds of things
that we want, the feedback we want, and then we can act on them once we have a complaint.
Okay. We've got about 7 minutes, Doc. There's so much we need to do downstream, and we'll do that based on your availability and availability of your officers as well. For example, fitness to practice. Yes. Are you fit to practice? Is it just a technical issue? Is it about skills? Is it about other things? Is it about substance use, right? And other things. We'll look at those things. But in terms of these kinds of decisions, I think what I'm getting from listeners is this sounds great, but we've had great stuff before. What is the level of commitment? It's not like a judge's rule.
Yeah.
You've gone and talked, you drank coffee and tea and other things. Yeah. You've decided to take nice pictures and you said good things. How can we assure the Ghanaian public, especially those listening to us now, that you actually are seriously, right, unequivocally committed and will see this through?
Yes.
Okay.
So
how do we do
a number
that?
of things.
Yeah.
There is the political will.
Yeah.
His Excellency, the Vice President, mentioned others were that they are waiting for the consensus that will arise from the conference.
All right.
And the Minister of Health, the same.
Okay.
Then we had the Presidential Advisor on Health,
Dr.
Isiasari was there through. And in
Are
fact...
they not going to play political football with this?
No, this is a professional matter that is beyond any political party. That's why
I get worried, and I am allowed to do that when I sit on this side of the microphone. But I get worried that, of course, it's good to have and demonstrate governmental will.
Yes.
And then we may have a vice president or a minister and so on. So attend our celebrations, the reflections, the conferences. Is that not the death trap, meaning that it becomes political football?
No. So what we do is, and this is not the first time.
All right.
You remember the last time we engaged, I indicated to you our policy on training of medical and dental students in other jurisdictions.
Right.
This also arose out of an inquiry we made, and we traveled to jurisdictions.
Yeah.
Usually our conference report will come with the key discussions and come with a policy brief.
Good.
It is our expectation, and we are engaging all political actors. It's our expectation that those policy briefs would then find space in the government's plan, in manifestos of all political parties come the next election cycle and things like that. So, and as I indicated to you, a lot of the things, consensus has been given and affirmations have been had, and we have already started implementing them. For example, we are having the objective structure clinical examination for foreign trained to ensure that we properly protect the Ghanaian public from next month. It's effective this year and things like that. So I want to confirm that as the statutory agency seized with the responsibility to deliver on this, we will do our best to ensure that the policy options that are immediately within our capacity, we go ahead to implement. The ones that will need budgetary support, we'll look at the various sources, including looking towards development partners. And you saw that in this conference, it was the WHO, which is the development partner, the health sector lead, that graciously supported us. And so we will continue to take those partnerships to be able to make sure that there's a budget to the program of work that may be required of us to implement the ones that are at our level. And the ones that require political will at the higher level, we are going to provide that in a policy brief to all the political actors. And then we are going to hold them as a profession to those commitments that are made. And because this is what the profession is saying, and the profession is judging this in the interest of Ghana, not in the interest of parties.
A political party.
And this state was there before the political parties came. And we must look beyond. And in medicine, actually, there's no NDC, MPP, CPP, and this. I mean, as you know, there's no race, there's no ethnicity, and there's no, gender and things like that. Yeah.
Great stuff, great stuff, great stuff. And I'll tell you something about Divine, I'm so proud of him. But sometimes when I look at the magnitude of what they have to do, what they have to balance, sometimes I feel sorry for him. But we can only give meaningful support to make sure that these things manifest and they come to pass. So those are good things. I don't want to go there, but Doc keeps saying political will and agenda 111. La General Hospital was demolished how many months ago? The day in Maryland. These are the kinds of things that come up.
But I mean, I'll just say that it is possible. What we are saying is that we don't expect all of this to happen at the same time. In fact, we don't even have the specialists to be able to train in all regional hospitals as we speak now. what we are saying, once the consensus has been had,
you're setting
once
down
the memorandum of
blueprint.
understanding, a blueprint, the college is going to move to assess the regional hospitals, looking at the resources and logistics. It may be that they may be able to train only one discipline or sub-discipline in that region, or 3, and like that. So incrementally, and working together with all of us as Ghanaians, we should be passionate and not be satisfied with where we are. Because with the technical competence and the quality of the technical competence of our doctors abroad, please, we can do this locally.
Right.
And once there's now general agreement amongst all the critical stakeholders on across the political divide that this is where we should go, I think that what we can do is to ensure that we back and provide support to the Medical and Dental Council, the Ghana College of Physicians and Surgeons, and all relevant stakeholders, and hold us to account for the support you have provided for us.
Okay, great stuff. You know, when you hear a head of institution, a CEO, or somebody say, hold us to account, it sounds great. It sounds great. And we will do definitely and exactly that. We've got upcoming programs with Dr. Benyubala and his team on fitness to practice.
Yes.
Are you fit to practice? We've talked about registration. We've talked about training. We've talked about the measures and the indicators that they look at for practice. We will prosecute that here so that you know when a doctor is behaving unprofessionally and contrary to the expectations and the standards, right? And then we will look at this legal and clinical issue of medical mismanagement.
Yes.
How do you establish that, right? And remember, Divine is a lawyer, a physician, an ethicist, a philosopher, all rolled in one. So let's give him our prayers and our support. But if you have any issues, let us know on Ultimate Health, and we'll package them into a program that serves your very need. Many thanks once again, Dr. Divine Benyubala Bala, the registrar of the Medical and Dental Council. Many, congratulations to you and your team. We host you, but we know there's a broader, wider multidisciplinary team for this successful conference, and then the reflections will most definitely continue.
Thank you so much for your support.
Thank you.
We are grateful.
Right, thank you. Stick and stay on Joy 99.7 FM. We go for some slow jam music. Don't make any mistake. Don't touch the dial.